Wes, are you able to start recording? Oh, she did.
I just did.
All right, it's 5:02. This is Patty Silva, Council Chair, and welcome everybody to our January 16th meeting of the Council on Developmental Services. Just for recording purposes, if you are going to speak, just please say your name and your firstborn. No, just kidding. So that people who are on the phone will know that you're speaking, and that will be very helpful. Thank you. I see Adriana has joined us too. Okay. All right. So I thought that for those who were not at our last meeting, we could perhaps have Phyllis introduce herself. She's on the phone. She does not have internet where she is, but for those who didn't have the pleasure of getting to meet her at our last meeting, Phyllis, if you could just maybe introduce yourself and just tell us a little bit about you, and so we can properly welcome you again.
Okay. My name is Phyllis. I'm an occupational therapist. I have been working for over 40 years. I've worked most of my time, I've worked at Southbury Training School, and we issued in a lot of licensing and ICF during my time there. I've also worked for DATAR, but now it's Abilities Beyond Disabilities. I've done group home contracting. I do home care work now, and I have a lot of experience in coming up with programming that is motivating to the individual, as well as being helpful both physically and mentally. So I'm definitely looking forward to, maybe working with people that are looking at the individuals at the hospital for special care and developing something else for them. I have a lot of experience in that, and maybe some other ideas that, people come up with. I have a lot of time on my hands now, and I'd like to be more involved with everybody. There we go.
Wonderful. Thank you so much, Phyllis. And for those who were not able to attend the meeting, did you want to just give a quick introduction of yourself to Phyllis? I think I had Nicole, Faye, Shannon, and Jordan. I think everybody else was there, right?
So this is Jordan Sheff, Commissioner at DDS. And we had a casual introduction before we started recording, but I will offer what I've offered others. If you'd like to get to know more about me or the organization, I'm happy to meet with you one-on-one outside of council time, but welcome aboard, and I'm very happy to have continued Southbury Training School representation on the council.
Well, thank you.
Nicole Milo. Phyllis, I'm a parent of a son with very profound and complex needs, and I am now officially a qualified provider. So I'm learning and growing, and really happy to be part of this council with a lot of people that are very kind and wanting to serve individuals with IDD. And it's great to have you.
Oh, thank you very much.
I'll go next.
Hi, Phyllis.
Go ahead, Faye. No, go ahead, Faye.
Okay. I'm Faye Lenz. I am the parent of a child with IDD, and I have been involved in advocacy since he was a year and a half old. He's now 44. That's really dating me, but that's okay. Wow. I've been involved. I right now also chair the Connecticut State ARC, which is a great advocacy organization. And I am married to my wonderful husband, Rick, and we had 6 kids, all boys, and Danny is the youngest. So nice to meet you.
Nice to meet you. 6 kids. It's like your own basketball team.
And a sub. And I'm in my car, so I apologize for if you hear any noise in the background.
So, hi, Phyllis. I'm Shannon Giacovino. I'm the DDS Buds person. I am also a family member. I have an aunt who passed away this past year, who was 85 years old and received services from DDS for most of her life. I would love the opportunity to connect with you and to learn more about what you've done and, what some of the ideas that you have are. I will reach out to you.
Absolutely. Please do. I'm looking forward to it.
Okay, thank you, everybody. I think that was everyone that wasn't able to be present at the meeting last month. Next item on our agenda is opportunity for public participation. Is there anyone from the public who would like to say a few words? I don't believe there is. Okay, we will move right on here. The next item are, just to reiterate to everybody that the previous meeting drafts, transcripts, and videos are all available on the DDS website, which happens to be down right now, I think. But there is a live link in our meeting minutes where typically it would connect you to that information if you want to go back and look for anything. Maybe Wes, or you or Jordan explain a little bit about the website? And I see Jordan has his hand up.
Yeah, so thank you, Jordan Chef, DDS Commissioner. The problem with the website has been described by our state CIO as being very unstable. It may let you in, it may not. The stability increased after 4:30 when they try to fix, but they also think that there's lower traffic on the website now. It's not just DDS, it's anything that ct.gov right now is struggling. So it's working a little better right now, but he's not sure what tomorrow morning will bring when traffic ramps back up. And they've had recurring problems since October with website instability. So they're aware of it and monitoring, but it isn't operator error on anyone here's part. It's just kind of the state of the ct.gov domain at this point for now.
It's Faye Lenz. I just had a quick question. Is there any way of getting the minutes, the past minutes, like sent to us in a Word document or a PDF file, or so we don't have to worry about the website? I don't know who to address that to.
So Jordan Chef, DDS Commissioner, Faye, we've moved to using the recordings as minutes or a recording of the meeting with only formal actions being noted in any written form.
Okay.
We can let you know what we have, and I believe that there's transcriptions from the videos that can also be had. But Wes and I will reach out to you tomorrow and follow up as how we can best get you that information.
Thank you so much.
This is Patty. There's a guy, his name is Rick Lenz. He might be able to help you too if he saves anything.
Oh no, I have to ask him. I'm kidding. This is Faye. Kidding.
I hear he's pretty nice, so
He's very nice. Thank you.
all right. So if that's all with that topic, we'll move on to Shannon with her ombudsperson report for December and January.
Hi, everyone. This is Shannon Giacovino, DDS ombudsperson. I also want to apologize for missing the last meeting. I had COVID and I didn't want to give it to all of you, so I stayed home. I didn't receive any questions on my December report, and I received one question on my January report. Christine asked for the DDS complaints, whether they were individual or systemic. And so they're all individual complaints, but some of those complaints, I think, reflect some systemic issues. I think we have more people from the community going into DDS public settings. And, there's been, with that increase of people, there's been an increase in the number of complaints in those settings. These are things that I've discussed with the commissioner and the deputy commissioner. I think that, DDS public hasn't had, I think, such a big influx of people from the community in a long time. And I think that, there's a need to kind of revamp some communication structures with families and, for staff to be trained on guardians' rights and individuals' rights. They're not issues that are related to care. It's more just about how people work together in those settings. I think, a lot of people from the community come with a different set of expectations. So I think that's why you're seeing a little bit more of an increase. And that's all I have, unless anybody has any questions. I do want to thank Nicole Milo. I've had a few families reach out to me in the past month who have loved ones who are who are loved ones who are children who have been in and out of the hospital a lot, who are seeking residential placement, which is not something that, DDS provides. And so I've connected Nicole to a few of those families to kind of walk them through how to advocate with other systems to get their loved ones' needs met. So thank you, Nicole, for being such um, a great resource to families and always being willing to talk to people.
Anytime, Shannon. Thanks for trusting me with that.
Pam, I saw your hand go up.
Yeah, I had a question, Shannon. Pam Don, council member. Why do you think more families are choosing to go to public services?
Well, I think we have the step down unit. So we have people who are going into the step down unit because they're in need of those types of supports. And I think for a lot of families, it's not necessarily a choice. It's generally because there isn't capacity in the private provider system to meet people's needs. And so DDS Public has been taking more people on who can't find a provider anywhere else. And I don't know, Jordan, if you want to elaborate on that or if you have anything to say about that.
Jordan Sheff, DDS Commissioner. I have a bunch to say that I'll cover in my report, more generally around public. But I think that the individuals ending up getting public services right now are people who've been, we've been unable to find other in-state solutions for. And so if I can find an in-state solution versus an out-of-state solution, and we have capacity in public, vacancies in group homes and for more complicated care at the regional centers. The I approve all of those admissions directly with our public director. We don't take admissions to public lightly. And we're talking about, in some cases, individuals who we've made 20, 30, 40 referrals. And it hasn't been about rates when we've done that. It hasn't been a provider saying, I can't do it for a Lawn 5 or a Lawn 7. It's been, I can't meet their specific needs for these reasons. So that's why we've been entertaining admissions to public over the last couple of years.
Okay. Are you all set, Pam?
Pam Don, council member. I guess I would ask, what would be the one area that you would say is an unmet need for the people going to public?
Jordan Sheff, DDS Commissioner, I would say there are two general areas in which public can do some things that we have not, don't always have currently with the workforce crisis capacity in private for. One is continuous nursing and clinical support from a medical perspective. And the other is for co-occurring mental health and IDD situations where someone may be involved in a level of care that it can be violent at times towards themselves or others, and with providers staffing shortage, they're reluctant to take on some very challenging individuals. And I would say that those are I wouldn't limit it to one because I think, and I think Shannon would say the same thing. Those are probably the two areas we get the most calls about. I've been waiting, they've been making referrals, and I can't do this anymore. Or we're admitting them directly from an emergency room or hospital setting directly to public, having had them wait in hospital settings for oftentimes 6 months or more.
Thank you.
Any other questions regarding that? Okay, Adrian.
Okay, hi. It took a while for my hand to go up. Well, I think that's troubling but good news because we know there's the waiting list for people with severe needs. I mean, because I sort of marinate in the world of severe behavioral issues with autism, I know many families that are very desperate and have been rejected, day programs rejected for, nonprofits, and they still have needs. I mean, one family that I'm close to, the dad is 77, the mom is 69, and their kid is really smart in many interesting ways, but can be quite, just pops off with pretty severe aggression. They can't find, I mean, they've been rejected. And if they could get into a regional center or, it's getting pretty desperate for them. And I'm not giving names, and some of you might recognize who I'm talking about, but so if we have resources and that family could be helped, I'd say let's use them. We can't just wait and wait and wait for more resources to be developed if they're there now. So, and I know we had talked about we have one precious step down unit. We probably need 5 step down units in the state. That's a whole nother discussion because it involves money. But anyway, so I'm glad to hear that the space is being utilized for people that really need it.
This is Shannon Giacovino, DDS. I'm Bud's person. I mean, I think that it's a great thing that, when there's nowhere else to go, we have a place for people to go, but there's also a limited number of beds and places for people to go in public. And I just want to remind everyone that the legislative session has started, and now is a great time to be reaching out and talking to your legislators about the staffing crisis and how it's impacting families like that. I would have that family be up there talking to legislators as much as possible.
Already doing it.
Good. Good.
Okay. Patty Silva, Council Chair. Anything else? Okay. Ready to
Patty, I
move
think
on?
Michael has his hand raised. Michael
Oh,
Bella.
Michael, I'm sorry. Go ahead.
That's all right. Michael Bell, council member. And I guess the question is if there's been a challenge with, private nonprofits being able to serve a particular population, not because of the staffing shortage, but because of training and ability. Is there a need to figure out a way to encourage the local nonprofit? Because obviously, many families, if preferred, would keep their child local rather than go halfway across the state for an opening. Of course, in an emergency, they're going to hopefully they'll put their child to the place where they need to be. But is there a way to incentivize or provide training to nonprofits in different areas of the state to be able to provide the services for these individuals? Again, absent, not having enough staff, and I get that. That's a different issue.
Pam, go ahead.
Pam Donaroma, council member. We happen to have a partnership with UConn, as well as having a number of staff with their doctorate, but we would be challenged in taking individuals mostly because of workers' comp, because we've gotten to the point where when Futures first started, we would take anybody because this is our area of specialty. Yet we've had to now be a little more discriminating in who we accept, because we've had a few workers' comp cases and it kills us financially. We would go out of business. So unless there's some sort of solution around providing workers' comp through the state or some other means, it's cost prohibitive. It's too risky for the organizations.
And I know Michelle, I know Nicole has her hand raised, but I did want to say to Michael's question, this is Shannon Jacobino, DDS and Budsman. DDS did provide some incentives to providers in day programs to take people with higher levels of need. And I think there was also funding there for extra funding there for staff who needed specialized training. So there have been incentives. I don't know if it's resulted in more providers taking people, but I do know that there were incentives for day programs specifically.
Nicole Milo, council member. I wanted to respond to Michael as well. If I were speaking in regards to my own situation with trying to meet my son's needs and figuring out how I'm going to train staff appropriately, that's been a real challenge, mainly for us because it is very difficult to find BCBAs and clinicians that are willing to work with the adult population and willing to because there's some complexities when it comes to Medicaid reimbursement, wages, and different things. So it's difficult to access the same supports that kept these individuals mostly stable during their school age years. So I'm personally working on some creative options of partnering with a clinician that's not too far from where I live, but that's also a challenge depending on what part of the state you live in. And I understand what Pam is saying about workers' comp and liability issues. So creatively for me as a parent, I want to talk to, I just met Mike that works for DDS that does the companion, help me out here.
Michael Gross with our Community
Yes.
Companion Home Program.
Yes, I met him today and I loved what he's doing, and it's creative and it's innovative to really empower families. And I think there's some more work that can be done on that end, but I realize that I might be a little bit of a younger parent with a 22-year-old. But so for right now, this works for us as long as I'm healthy and able to do it. And if we can empower other families to be able to do that, that might help. So I'm just kind of offering, my own experience to kind of contribute. It is extremely challenging. I'm working with at least 5 or 6 other families that are all in crisis, and they have no agency that will take them like on the entire East Coast. So it's really it's a problem.
So if I can suggest we transition to Jordan Sheff, DDS Commissioner. Transition, because I'm going to cover some of this in my own report. Madam Chair, with your permission, we'll transition to my report and I'll just continue some of this conversation for us all. Is that okay?
That's fine. Yep.
Thank you. So I think you're all on to a lot of the work that we're trying to do in some small pockets and some bigger pockets. And Shannon suggested we've tried to do some enticing with the rates. And I can tell you that within the rates, outside of the rates, there are some individuals where we've had individuals stuck in hospitals or other settings for way longer than we ought to, where when we refer them to providers, we don't say, here's what can you do for this much funding? We just want to know if they can take them. And if they come back and say, well, we can't take them at that number, but we can do this, we're at a point where we do that. So while in prior years people were held out of placement because we didn't have money to place them, it isn't funding at that level. And I say this because I can hear Rick Rothstein in my head. Hey, Rick, if you're out there watching. Yes, if we could flood all of the rates with a lot more money and drive everybody's wages way, way up, maybe we wouldn't have the same problem, but we're having to do it in a very targeted way. So we have enough funding to target it at some individuals with specific needs. That doesn't mean that the concerns that Shannon's suggesting people advocate for haven't been fully addressed in all the funding we need to support all the people. So I say that to say that, we have groups working on complex care, individuals in the behavioral realm, and what solutions we might come up with. And we've actually, I won't name the agency, but we've actually piloted some day programs to see if we can find the sweet spot in rates where RBTs, registered behavior techs, and BCBAs would be involved. We're working through that. I think we're on our second round of piloting there and trying to figure out what we can do. Similarly, Mike Menard at Lark and a number of his colleagues have pulled together to target specified training for trauma-informed care for people where mental health and IDD is really the issue, less the autism mix and more the mental health mix. And we are looking at rates around medical modeling, and looking at some policy reform that I can't really get into the weeds on now. Pam's probably, because of her the gift store, probably a little more familiar with how many people at Hospital for Special Care might otherwise be served in the community based on the fact that we don't have the level of care necessary for full suction and tracheotomy care in most of our group homes because of the state requirement to have a supervising respiratory therapist. So there are three pockets of really acute level of care that there's lots of areas we're trying to improve. We're really looking at those three things on a regular basis. There's a regular and ongoing conversation. And when we do that, we look both internally here in the state and we look to other states nearby and across the country. So I just wanted you to know that your concerns and your thoughts we incorporate all that into our daily work as we try and improve the overall system. I'm going to cover a couple things tonight in my report. First, I wanted to let you know one of my regular duties is to be part of the Messier settlement agreement and what we refer to as parties meetings, where the plaintiff, the defendant, and the remedial expert meet on a regular basis to discuss our progress based on the Messier agreement for the purposes of examining the needs of individuals at Southbury. As a reminder, the Messier agreement doesn't call for closure. It also doesn't call for keeping Southbury open. Its primary call is to ensure that we are routinely offering education to individuals and their guardians and their loved ones around benefits of living off the grounds of Southbury and somewhere else in the community. To that end, I'll share with you that this month we dipped below a census of 100 for the first time. And with some people moving off campus, we'll be down in the neighborhood of 90 over the next 6 or 8 weeks. I've had meetings with a number of advocate groups. In addition, I'm looking at pulling together a table of interested individuals to discuss. I'm not talking about the closure of Southbury, but the future of Southbury, both the individuals who live there, but also largely the buildings and the grounds. We have an awful lot of land there and buildings there. So with that, we had a very successful meeting. I think it was attended by the director at Southbury, Kathy Hanowitz. The remedial expert was in the room, and a number of individuals that are part of the parent teacher, the Home and School Association. And some of whom are former staff, many of whom grew up in the neighborhood of Southbury Training School, who may not live there now, but are intimately aware of the work that's been done there, the varying conditions over its history and all that. It was a very productive meeting. They were very interested in joining me at that table, and I'll continue to keep you posted. But I went with a notion of just urging them to consider, because we're going to continue to downsize there. Their loved ones will be moved repeatedly as we go from the 7 cottages that are there now. Over time, it will get down to 5 and then 4 and then 3. As we continue to lose numbers, loved ones are going to get moved around. Pairing and matching gets harder when there's fewer people to sort of make that work. And so maybe their consideration would be to look at living in other opportunities, whether that's one we develop or taking advantage of existing opportunities. So that was some of my work this month. On the flip side, right, so we're talking about institutional care. I was at a groundbreaking today in West Hartford, not far from Bishop's Corner. The Department of Housing was present. Lieutenant Governor, the governor, a number of the mayor of West Hartford, and a number of other dignitaries and politicians. But it's another example of the supportive housing models we've set up repeatedly over the state, and we're continuing to penetrate new areas and new towns. This is not the first in West Hartford or the West Hartford area, but it's in a neat little area, and CRI will be the provider of those supports there. They're also considering not just individuals eligible for the department, but maybe considering individuals on the autism waiver who need some level of support and could benefit from living there in West Hartford as well. So that's pretty exciting and kind of the uh, the other end of the continuum for me in that way. Um, I'm going to give a quick a quick legislative rundown, and then I'm going to talk a little bit about public again. Come full circle. So I'm not sure because of some of the struggles we've had with IT stuff, if the bill proposals or links to the bill proposals have reached you yet, but the department basically has four bills at present. Many of you familiar with the legislative process know that it could be four at the end of the session, it could be zero or anywhere in the middle, and they may be combined and they may look different, but our four initial proposals, one is about being it's another access issue. Being able to provide diabetic care in our community homes, our group homes, and other like settings that would allow certain diabetic care responsibilities to be delegated to direct care staff. What has prevented this for years is the fact that they would need to do assessment in terms of determining the amount of insulin necessary and then using a needle, draw that insulin and inject it. Nowadays, there are a lot of injectable pens where the amount can be dialed up at the top of a pen. It needs no special training to inject it. Anyone can inject it, and it's not a particularly deep injection. So we have worked, and Jill Kennedy, who works for Kevin, who formerly was at Public Health, has worked really hard with her old partners at Public Health and with our clinical teams to advance this. And we hope that will increase access for people who have diabetic needs to our group homes. Often we can't provide certain levels of diabetic care currently. It'll still be limited, but hopefully it'll be less limited. The second bill is about our registry. Someone was just talking about community companion homes. I think it was Nicole was talking about Michael DeGrosse's work on community companion homes. Currently, community companion homes are not employees. Our statute on the use of the registry refers to separation of an employee from a qualified provider, either the state or any of our private providers. As such, CCH providers who have been found to be perpetrators of substantiated neglect or abuse are not referred to the registry. This proposal will fix that. It is not a large number, but it is a loophole and an area we would like to remedy. Third, and some of you, Adrian at least, have been around when we used to have the behavioral we had the behavioral support had a name before that, voluntary services program, which became the behavioral support program. We are rebranding that through this bill as to create a children's division, as there was a time where we were only and primarily supporting children with high level behavioral needs. And we have found that we provide a variety of services, even if not residential or annualized services, to a number of children. And we want to make sure that we capture the ability and the notion that we serve throughout the lifetime. And so that is one other bill. And then lastly, another party is a separate part of the registry. We have had ongoing discussions for a while. Kevin, myself, and our legal team, with our lead in case management, Wayne, with the Judge Beverly. And Kevin, you can later remind me. I can't do her last name. She goes by Judge Beverly even when she's testifying. And all the legislators call her Judge Beverly. She's the court probate magistrate. She oversees or coordinates all the affairs statewide for all the different probate judges. She, in working with us, was concerned that she could, and her colleagues in probate seats could potentially assign a conservatorship or guardianship to someone who was on the registry and not know it. She would like to be able for the probate judges across the state, when determining the need to assign a guardian, to be able to peruse or at least verify that the names they're recommending for assignment as a guardian is not someone who's also on the registry. Um, uh, and so I think there may be some other things around a limited financial guardianship um, in the bill as well. It's a carve out so that we don't have to go to the extent of conservatorship through the courts to get limited financial support and a focus only on the finances. Some individuals only want that portion covered. And for many of the advocates that I've had the opportunity to work with, guardianship is a less restrictive, or at least in terms of a label, a less restrictive sounding thing to say you have a limited guardian versus just saying you have been conserved. And so this keeps it out of the realm on a person-centered basis from that higher level threshold of conservatorship and keeps it in the wheelhouse of guardianship. I'm going to cover public and then I'll open up for questions. So when I came on board to central office as deputy commissioner, and even at my time as regional director in the Malloy administration, they were very different fiscal times and a very different culture, and we were had our the pedal to the metal on looking to downsize and close public programs. And I have been part of DDS to oversee the privatization of over 40 group homes, the closure of 2 regional centers, and other downsizing in public. That trend started to come to an end even prior to COVID and screeched to a halt during COVID. And there does not seem to be that pressure. And as we discussed earlier, not only is there not that pressure, we have had to rely on public to take individuals who we might not otherwise be able to serve, or we would need to ship out of state to at an exorbitant cost without federal reimbursement, with not the level of oversight we can provide here in state, and not the connectedness to families that's part of our mission. So with that, at the time that I was at central office, we centralized public because seemed, as we were downsizing, it seemed simpler to have one person in charge of the whole thing statewide and shrink it and shrink it and shrink it. And basically, that person in that role knew that their ultimate goal was to work themselves out of a job, because we would close all the public. And I leave Southbury outside of that public umbrella for this particular part of the conversation. We're not there anymore, and as we have backfilled with the first of the step down units, and will likely be more, and now developing an acute care medical model in Lower Fairfield, at the Lower Fairfield Center. It doesn't seem to make sense to have one public region statewide any longer. For a variety of reasons. The regions were all the Northwest and South were making referrals to public programs, and through the public regional director, who did a phenomenal job of providing access, but was the gatekeeper for those very limited resources. And in partnership with me, we would consider admissions literally one at a time, with a thorough case review, evidence of how many other referrals were made, the list of the reasons private providers had declined to serve somebody. We did our diligence, because that was not our first choice, recognizing the longstanding conversation of the disparity in wages in public versus private, not wanting to bolster that argument and throw flame onto fire. We've been very judicious in the manner in which we've looked at public admissions. So it will go out to all of our staff tomorrow. You're getting a sneak preview, so you're not finding out about it tomorrow from staff, who then wonder why I didn't say anything tonight. We informed all of our partners in this. We'll be working with labor. There's very little disruption to our 1199 frontline staff. Most of the disruption in this reorganization will be to managers and directors. But over the next 6 or 8 weeks, we will reorganize public to be a divisional responsibility. And it'll be broken up a little differently than it used to be to create some parity for the three people in charge of those three portions of public. And that will also give the regions an opportunity to have an additional resource internally to their region to consider those placements. And I'll still continue to determine where we make any long-term admissions. I will allow the regional directors to consider respite opportunities, non-permanent, where they have capacity, non-permanent placements, but anything permanent would still come through me. I had a longer list than I usually do. I think that is all I have. I'm happy to take any questions on any or all of that. Nicole Milo.
Nicole Milo, council member. I just had a quick question. Is the DDS abuse registry, is it affiliated with the DCF as well? Because I didn't know if those would be two separate inquiries or if it covers both agencies.
Kevin, I'm going to defer to Kevin because he's been working on this with Jill legislatively. Some are shared in one direction and not the other, and others are not shared at all. And I don't know it off the top of my head. And I'm asking Kevin if maybe you know what gets shared in which way or not.
Yeah, Kevin Bronson, DDS. So I'm not sure about the DCF registry, but I know about our registry. DCF has access to our registry, if that answers your question.
Okay,
Nicole.
I just wanted to kind of raise this awareness or concern. There's some different from what I gather, and I'm still learning. A person that is found substantiated on the DDS registry can, petition to get off of it in 5 years' time. But oftentimes, just from my own personal experience, when somebody is substantiated through the DCF registry, it has to go through the judicial court systems. And a lot of times it's a lifelong, you're on that registry for life. And it can be more serious depending on the nature of it. And so I don't know if that would be important for providers to be able to check that if it is separate. It might be something that could kind of get missed. So I just wanted to share that.
I appreciate that, Nicole. And I don't know enough about the DCF list. In my head, it would seem prudent that anybody who has a registry list share it with anyone else who has a registry list. But I don't know enough about those lifelong bans. While we have a removal process, it's not simple. And it can take some time, and not everybody gets approved to come off just because they haven't offended again during 5 years. There are certain things that because I'm the final, there is a hearing officer, but I get final say often. We're pretty careful about who we would consider letting off that list and not. I'm unfamiliar with DCF's process, but I think that by sharing now that we are getting their list and some of the questions from the Office of the Child Advocate to DCF, that I think we're moving in a direction of more sharing. Some of the lawyers get involved and get really caught up in and I want to be careful, not caught up. They pay a lot of attention to the due process rights of all individuals involved, as well as the privacy rights of all individuals involved. And sometimes that has limited sharing of information, registry or otherwise, between state agencies. But that is an area where we've been requested as state agencies to make some improvement, and there's some ongoing conversations around that, but nothing ready for prime time yet.
Yeah, Kevin Bronson, DDS. I could mention, Nicole, that I think it was last year or two, over the course of the last 2 years, we've added our sister agencies to our registry for access. And I think probate is probably the last, most obvious group that should get access to it.
Are there other questions for me this evening? Adrian, you can use your regular hand and not the electric one. I'm okay with that.
Well, I finally figured out how to use the
Thank
electric
you.
one.
I'm in the car and it's a little
Oops.
easier to do that. I'm going to meet our new senator and have a meeting with him regarding the legislature session that's coming in. Anyway, that's an aside. I just want to say, because I think it's very potent, is the one of the people who died this past week from Southbury was the oldest living person at
Oh,
Southbury. I think
wow.
he was in his 90s, and went to Southbury when he was 13,
Oh my
and
God.
he died in his 90s. And I
Wow.
just, it's sad. It's sad. And I know the numbers are going down, Commissioner. Um, and I think what I heard this past week was in the low 90s or 95. Some people are going into community and stuff. And I would be interested in being a part of that gathering and what's going to happen as you move along when your down numbers are down. Because one of the questions that came up was just what you're talking about. What's going to happen to the buildings, the grounds? What are we going to do when you come to the end of this?
So I just want to clarify because I have that was Faye speaking.
Yes.
Okay, just so we can add you to the list. Yeah, we will be growing that table. We're going to start small and grow over time. I didn't know, I've met him, but I didn't really know him, the individual who passed away. Um, and I'll send out the staff message to this group. Wes, if you can help me to remember to find it. We did a tribute to him. I think it was 96 or 97 years old. Um,
Mhm.
he had
97. Yep.
yeah, and from all stories told, a real character. Um, and he went there at a time where that was the recommendation families got. He survived the worst of times there, and got to flourish in what have been some of the best times there, and was just really well loved by everyone on campus. They've lost a few people recently, and so and it the fewer people they are, I think the deeper the pain a lot of times. But to testament to public staffing, he lived a healthy life for a very long time, and led a very, very good life. So thank you for calling that out. And I'm going to add you to my piece of paper here about the STS table.
Thank you. And yes, I think he did live a full life in many ways. Bella was his name. But
Yeah.
This is Phyllis, and I knew him, and he was a charming, charming gentleman. From in the 40 years that I worked with him, he was blind, and he was so independent in his routine that we would, he had a structured environment in terms of him being independent in getting to the bathroom, but getting back into his room, getting into the dining room, integrating with people. He really was an exceptional human being.
Thank you
He
for
will be
that.
missed. Many people.
Anything else for me? Adrian, your hand is up.
Yeah. Adrienne Benjamin, council member. I have several little things, some of which are related, some of which are independent. I was glad to hear you mention RBT, which registered behavior technician, because we know that that's a great way to introduce staff to the issues people face with autism. And I know the BCBA that works with my daughter. They have one BCA at all of HARC. It's a big organization. She says, "Oh my God, if we could get more RBTs, everybody's life would be so much better." So that's good to hear. And at the last meeting that you were not at, and Eliza stood in for you, she mentioned that some of the initiatives from last year to move people, I guess the goal was to move 100 people out of group homes, to get them into less supervision because they didn't need that much care. And she said it was pretty close to 100, so she was praising that, and sounds great. But what I forgot to ask her is how many people, part of the goal of that was to move people, there'd be more room in group homes, so to move people into group homes. So I'm wondering what that number is of people who were able to move into group homes now that there's more room in them.
So I appreciate that question, and you may have other questions, but I'm going to lose that question if you go further. So I'll come back to your list in a minute.
Okay, thanks.
It's very hard to slice the data in a way that shows that direct number. And Kevin has his hand up and may have it. Because what we show in our data system is people coming and going and moving. What I can tell you is that this last year, I'm going to bring it up for me. In 2024, I'm sorry, between 2014 and 2023, we averaged 457 individuals placed in residential supports. That was our average over that 10-year period. In fiscal year 24, 837 people received annualized residential funding. That is
Wow.
that's a big number.
Big number.
And we are trying to find a way to grab from the data exactly how many that is, but the way our data is kept, short of keeping a hand tally. So anyone who moved out from any setting to whether they were supportive housing, whether they were CCHs, whether they were self-directing, any number of modes of support, if they left a group home, with the exception of two very small, not very accessible group homes, we backfilled somebody into their space. So if we know the number is roughly right now 90 people have moved to less restrictive settings, then 90 vacancies were created. Whether or not agencies and DDS have fulfilled the obligation of filling all those opportunities or not, I can't tell you today, because I just don't know. We can try and find that out. But those vacancy opportunities are made known to the regions, and then it's incumbent upon providers to, while we actively make referrals out to those agencies, we also have a public for the providers to see. It's not public, but a number, all the people looking for placement on a placement portal list.
Okay. It'd be great to get that number though, since that was part of the goal, is not just moving people into less restrictive environments.
Yep. Well,
But
we didn't eliminate any bed stock, except I think in those 2-3 beds where there were lots of stairs and needed lots of repairs, and they were just no longer, they weren't going to be good places for people to live, particularly if they're coming with heavy behavioral needs.
Well,
You
it's
need some
gotta
space.
Everybody, it has to be a good fit, of course.
Yeah.
And it's not, yeah.
Yep. We'll
Okay,
try and
thank
pin
you.
that. We'll try and pin that down as we're starting to wrap up some of that initiative.
Okay.
Were there other
Ne-
questions, Adrian?
Yes, of course. You know, as part of my advocacy is handing out the 2019 graph of the level of need that you produced in 2019. And lately, the legislators have been saying, this is 5-year-old data. What's the current data? And I said, I don't know yet. But I wanted to ask you if you could produce a new level of need graph so that we can show the legislators where our population's at, like who DDS serves, how many 1s, 2s, and 3s, how many 6s, 7s, 8s, because it just gives them, to the extent that most legislators don't know that much about DDS world anyway, at least it gives us something fairly concrete we can talk to them about. So if you could produce a new one, I would appreciate it for this session.
I will, Kevin and I will reach out to Josh.
I think we have that.
Oh, I'm sorry. Go ahead, Wes.
I think we may already have that. I'm double checking now.
Okay.
Wonderful. Okay. Because the last one was 2019. And I made a lot of copies. The other thing, while we're waiting for that, is I've been thinking about, for reasons that are probably obvious to people here because of the abuse my daughter suffered in October. The subcommittee we set up in the council, which included about 6 of us, Kevin, Rick, Patty, Karen Havlock, myself, we asked Shannon to join us. We came up with some suggestions for the abuse and neglect process, in addition to the family guide, which I know is on the website. And that the last date of that was March 2023. So now we're getting close to a year later. 2 years later. So I haven't heard anything about if any of those ideas are going to be integrated. And I realize some people here might not know what I'm referring to, but we had the subcommittee with lots of people and came up with a whole bunch of ideas for that. And we'd like to get, I would like to get feedback on where that's at. I hope it hasn't been forgotten.
Not forgotten, but I think there are some recommendations we're not still ready to commit to timelines on is the issue, and in part, but we can follow up on that. Let me get a status update from Katie, and we'll get back to you.
Yeah, Thank you.
Nicole?
Hi, Nicole Milo, council member. I just wanted to make a comment and maybe just some helpful information to share. I'm appreciative of the work that you're doing on the RBT and BCBA behavioral side for those with higher levels of need. For providers that may not know this already or individuals that might be self-directing, staff can actually get their RBT certification for free. And I have some of those resources. The key would just be to be, find a supervising our BCBA, but maybe that is minimal. And I realize, there's other things being worked out with on the DDS level as far as reimbursement and things like that. But if people were in need of trying to figure out how to get their staff trained, or you have a staff person that has a desire to get more training, there are a lot of free resources. So I just thought I'd throw that out there.
Thank you, Nicole. Some of you were aware that my daughter was an RBT when she was living here with me in Connecticut, and she was shocked to find out that despite her certification and the number of clinical supervised hours to qualify for certain levels within that RBT, she had to start all over when she got to Virginia. So apparently there's not reciprocity, at least between Connecticut and Virginia. I don't know how extensive the lack of reciprocity is, but it was something I learned about the RBT process from Stella just recently.
Wow.
That's all right. She aced it. They love her.
Good.
Virginia's very lucky to have her.
You must miss her. Yeah.
I do. Every day. Anything else for me? If not, I'll turn it back to you, Patty.
Where is Patty?
I'm right here.
She's
Okay, if that's it, Nicole, that's a legacy hand, right? That's okay. Just wanted to make sure we're not missing anything. Okay, Patty Silva, Council Chair. Okay, next on our agenda is legislative breakfast. I don't think we can really pin a date down, but I did want to share that at our last meeting, we did form a subcommittee to work on the legislative breakfast. And the people who agreed to be on that committee, Faye, I have you down. I think you had told me you would, even though you weren't at the meeting. Kevin Zingler. Kevin Zingler, Pam, Adrian, Damien, and myself. So very soon I will send out a meeting notice, or at least pick your guys' brains for a good meeting date that we can all get together and kind of just start talking about how we want to proceed for this session. It is a long session, but we, want to try to get a jump on things, especially if we want to have things that we can actually hand out to legislators at the breakfast, which is, pretty effective and has been helpful in the past. So keep an eye out for an email from me where I'm asking you to check your calendars so we can try to pin down our first meeting date. If there's anybody else who was not at the meeting last month that would like to join, just let me know. We're always happy to have more help. So that's that. And then on the topic of forming or, assigning things, for the people who were not at our last meeting, we did do the nominating and election of officers. So I just wanted to let you guys know what the result of that was, which you probably have guessed. Christine and I were reelected and very appreciative of your support of us, and Damien is now our secretary. So that's how those turned out. So just wanted to let anybody who wasn't there know, because it wouldn't be on the website yet, or you can't get to it. So then next we have topics for future meetings, and top on that list is legislative breakfast, just to kind of keep that, front and center. Obviously, I don't think that we have any, again, indications of when we might do the breakfast. Wes or Kevin, I don't know if you have any updates on that at all, or that you could share.
Sorry, this is about the legislative breakfast.
Yes, yeah.
I don't know, Kevin, if you have anything to input here, but I think we need some more details from you guys as well. And I don't know that I mean, session has started now, so I think we're kind of within those doors.
Adrian, do you have your hand up?
Yeah, Adrian Benjamin. Well, our next meeting isn't until mid-February and the session started. And usually we have the breakfast, I think sometimes late February, early March. I'm not sure what kind of information Wes needs, but the first thing y'all need to do is get us a room, get us a space, and
Yeah, that's where the information part comes in. That's the stuff that I need. Oh, Kevin, you've got your hand up. Go ahead.
So it's, and we do need to discuss who we want to nominate. You know, we usually give awards to legislatures, awards to legislators, awards to an employer who's employed a lot of our folks, award to a self-advocate. So we have work to do. And if we don't even know, we really need to start getting the show on the road, please.
Can I just, it's Faye, I'm a council member. Can I just say that the Connecticut DD Council will be holding their legislative breakfast on February 18th. And we are supposed to have family hearing day on February 18th as well.
Wait, what?
So we-
Is the ARC family, I'm sorry, Adrian Benjamin, are you saying the ARC family hearing day is February 18th?
Correct.
Wow, that's important to know.
Well,
Right?
it just got resolved. We've been working with legislators to get a date. And
Sure, that's
unless there's
fabulous.
something else that changes,
That's
and I'll let you know as soon as I know.
So the DD Council is having it before that,
This DD Council is having it from 8 to 10,
of course.
and then Family Day is 10 to
Oh,
12.
that's so nice to know. Thank you so much.
So they're
You're
both on the
welcome.
same
And
day.
yeah, well, yeah, they usually are.
Yeah.
In the last number of years, they've both been on the same day. And we would encourage you to ask your legislators to please be in the building that day. Last year for Family Day, we had a lot of families, but we had very few legislators. So when you're talking to your legislators, please encourage them, invite them to be a part of this in person. Thank you.
Thank you, Faye. Kevin, you have your hand up?
Yeah, Kevin Bronson, DDS. So just, and I think I mentioned this last year too. But just in, I think that's what you guys did. Some suggestions on the legislative breakfast. So one, the Capitol is a legislative building, so your best bet on getting space and good space is through a legislator. I believe you guys used a legislator last year. I'm not sure. I wasn't involved with it, but I believe you went through a legislator last year and got space. So I would encourage doing that, trying that route again. We, if we, if West reserves space with through legislative management, it would be like any other, member of the public doing it. Because again, we're part of the executive branch, so we don't have much pull over in legislative management like an actual legislator does. So that would be, Wes and others are happy, we're happy to help how DDS can help, but in my opinion, and my recommendation to you guys would be to go through the legislator and do it now so you get better space than you did. And honestly, I didn't think your space was horrible last year, but that sort of stuff. That's all.
Kevin, you have your hand up, Zingler?
Yes, thanks, Patty. Kevin Zingler, council member. So we will work with House Majority Leader Jason Rojas to secure that space. Not a problem. So I think that's what we did last year. So, and I'll work with Wes on getting the paperwork filled out like we did that last year, Wes. So we'll take care of that. I guess the first question is we got to figure out a date. Not sure where we're at legislatively, so I think we need some advice and guidance on when would be a good date to do that, given it's a long session. When does the rubber hit the road? When's a good time to be visible up to Capitol? Obviously, it's every time to be visible up to Capitol, but is there a better time? Is it February? Is it March? Is it April? Where would we be best positioned to have the highest visibility? And given that the legislature is in session, because I know that one year, one of the organizations I was affiliated with, I think it was Art Connecticut, we had a legislative day and they weren't even in session and no one stopped by because no one was at the Capitol. So want to make sure that we maximize our time and energy and visibility. So I defer back to, I think, Kevin and the commissioner about how we go about doing that from a timing standpoint.
Yeah, just Kevin Bronson, DDS, and I could directly answer that. I would avoid, as humorous as it might sound, I would avoid the March Madness season. A lot of legislators are UConn basketball fans, and they usually will adjust calendars accordingly.
Yeah, and that's something, this is Kevin Ziegler from the DDS Council, that's something we learned last year too. So we can't outdo Gino and Dan Hurley showing up at the Capitol, so or not being there or on the road, I should say. So we'll work with you. We'll figure out how to do that. And Wes, I'll circle with you in the next week or two. We'll get some paperwork done, and we'll figure out when's a good time that legislatively we can make sure we capitalize on the most eyes there at the Capitol. So we'll do that. Thank you. I did have one more question or one more topic for future. I know that as part of House Bill 5001 that was passed, there was a transition college proposal from DDS that is going to be submitted to the legislature this month. So obviously, I understand that DDS is probably not ready to comment on that proposal, but once that does become public to the legislature, I think we should probably get an overview of that and figure out what that actually entails or what that proposal is, so that we can figure out if there's any discussion amongst the council. Kevin.
Yeah, Kevin Bronson, DDS. I can sort of answer that. So we're wrapping that up and going to be sending it over to the legislature in, I would say, the couple days, a week, finalizing that report, and then it'll be made public, which you guys can see as well. And I think probably the commissioner would just wrap it into his update in maybe February or something like that.
Perfect. Thank you.
Would be I don't know, but I defer to the commissioner now. So
If I can, I'm Jordan Sheff, DDS Commissioner. So I think there are a number of byproducts of 5001, and various council members may have various interest in any or all of them. So in 5001, in addition to a transitional academy for independent living, there were recommendations to have studies done on other things like the eligibility criteria, and a host of other things. One, some of those products are not owned by DDS. Some of them are very lengthy. So I think that we can talk about any or all of those in small part at council meetings. We would need a really long council meeting to cover any of them in depth. So my suggestion would be is that as they are made public, and the legislature gets the first stab at seeing them because they were products ordered by them, as they're made public, we can furnish them to you. And then we can decide, you as a group can decide how deep a dive we want to do, because I would be, we have various staff involved in various components of them, and so we'd have like a clown car of staff coming to the next council meeting to report on their each individual involvement with each individual piece. So if we can, I think it's important to talk about, Kevin, and certainly I think there's a variety of reasons people might be interested. I just want to make sure that we prioritize the most important things for everybody, and then we can make time offline outside of the council meeting for any deeper question Q&A you have on a specific component with the right staff present.
This is Kevin Ziegler, council member. That sounds perfect. Thank you. One last thing, and then I will put my hand down. I know that at the end of December, DSS released the Stafford Myers report on rate studies for the systems for all systems through DSS, and DDS obviously was included that through the waiver system, but didn't know if there was anything that we should be aware of for the legislative session coming up, because that rate study might be referenced in testimony from various people, and wanted to make sure that we understood as a council what the rate study actually says about DDS rates and how it compares to other states and the methodology used, et cetera, et cetera. So just more of an informational process for the council as we start thinking about testimony in the future.
So that Jordan Sheff, DDS Commissioner, that product is public. It was reviewed by DSS with DDS present at MAPOC. Someone out there's a BPOC and a MAPOC and a subgroup of the MAPOCs and the BPOCs, and I can't do that acronym. And Adriana, if you can do it, God bless you. But I can't do that one. So the at that so I will summarize it this way. The overall recommendation is to further look at the rates in certain ways across the whole Medicaid landscape. And so they provide some initial analysis that's not conclusive and begs some questions. So now we are digging into the analysis that they did to figure out exactly which data they used to arrive at these conclusions, to see if their thoughts make sense. So basically, new Medicaid Director Bill Hurley, his recommendation is that we would use time during the session and maybe beyond the session to start to dig in to that report to get what it's understanding. Nothing in it is binding. They did have us look at a bunch of states. I think it's close to 100 pages, somewhere between 80 and 100 pages. There are some tables in the back of it that show some rate comparisons. I know a lot about them, and I don't understand what they're showing. So we are digging through it ourselves, but we can make sure that a link to that is available to the council as well. There's two documents. There's the second phase of the Myers and Stauffer rate study, and there was another product developed. It might have been Boston Consulting Group, I can't remember, that looked at Medicaid as a whole and did some cost and rate looks at that. That's not considered a rate study. So I think you need to look at both of those documents together. And it's cumbersome and it's not everybody's cup of tea. But we'll make sure that we get some of that and any of the other byproducts that came from 5001 out to you. They're not all public yet.
Great, thank you.
Okay, I think Christine was next.
Hi, Christine Hainsworth-Strauss, council member. Couple things. One is when we think about who we're going to nominate for awards for the legislative breakfast, I wonder if some of the results of some of the things that have been impacted by HB 5001 would be helpful, like including maybe a few or all of the IHS providers that have come forward to bring forth this new model. That might be something to consider, as well as if people know of self-advocates, because I know we're kind of seeing less of the self-advocates in our meetings. So that'd be something I would like to see if we could remedy. On another note, and I sent it out just right before the meeting, the transportation meeting committee is now having a new statewide congregational meeting, I guess, for all the stakeholders, and it's January 29th at 1:30. It is on Teams. So if you haven't received the email forwarded, we will be sending it again. Wes, I don't know, did you receive it? And can you post the invitation in the chat?
Let me see. I can pull that up.
I'm sorry, I didn't have much opportunity to send it beforehand, and there was technical difficulty with just emailing it directly because there were 60 other people in the byline, so it was getting caught in everybody's as junk mail. So hopefully we'll get that information to you shortly. But I would highly encourage people across the state to get involved in this, because this is how to get people moving around the state. And it's interesting, in this process, we've discovered there's so many other parts of the Department of Transportation, or like they were redesigning all the bus stops bus shelters across the state from another department in the state. So we're coordinating that so that perhaps to maybe have put solar heaters in or something to keep people from collapsing in the cold that had medical needs. Also, one thing that had come up that I brought up in this was just, you know, how you can track the movement of something. If we could just bring down some of the anxiety around people catching their vans or their buses or ADA by just putting that in a simple app with the transportation providers so that people would know when to be ready. So there are lots of little things that can come out of these brainstorming sessions, which hopefully we will see as a result. But if you know anybody who has had transportation issues, please invite them to participate in this. Thanks.
Thank you, Christine. Nicole, you have your hand up?
Hi, everybody. Nicole Milo, council member. Kevin, I wanted to just respond to both you and the commissioner, what you were talking about with the Medicaid reimbursement and the comparative report. I had gone over that this summer because I was doing my own research. And then I met with my legislators, Lisa Seminara didn't win her race. So we were, I was bringing some of that to their attention. But upon digging, you might want to look at what the reform that they just did in Pennsylvania, because they did reform some of the rates specifically for people with autism in the clinical. And I think they've done some good work based on some of my initial digging. But if I can find more details on that, I can send it over via email.
Thank you, Nicole. They did in the current rate study analysis, they did do two different state comparisons. One was just an average of all other states compared to, and then they looked at a handful of states that were comparable in population and cost of living, but it's not clear how much cost of living is indicated there. But so I think it's important to look, and there are some states that have done some really interesting things, and states like Pennsylvania and Wyoming and I think Maine, so neighboring but also very different looking states than us, have done some really neat things around rates, consistent with some of the recommendations from Myers and Stauffer at their conclusion of their documents. So it'll be interesting. But if you have the autism stuff, Nicole, please send it to me. I'd be curious what our friends in Pennsylvania have done.
All right, Christine, do you have your hand up again? Okay. All right, Patty Silva, council member, chair. I just realized that I skipped over the discussion of our member directory, which is very short. I have almost finished putting it together, and it's really just for the use of council members and not going to be spread publicly. So I just have a few more people that I'm reaching out to gather information from, and then once I have that, I will forward it out to everybody. It's just for our reference in case you need to communicate with somebody other than email, or want to give somebody a call, whatever. So I check your emails just to see if I've just asked you if you wanted to add anything more to it. So that was it for that. So were there any more topics for future meetings? Okay, I think we're probably gonna, once we get really going on the legislative breakfast, that tends to kind of take up a lot of time. But if there's ever anything that anybody wants to, suggest, just, feel free to also email in between meetings as well too. So that's fine. So I think if there's nothing else, does somebody want to make a motion to adjourn?
I'll make a motion to adjourn. This is Kevin Zingler.
All right, Kevin Z. And is there a second?
Second.
Okay, Adrian. And so all in favor?
Bye.
Aye. All right, everyone. We are adjourned. It is
Bye, everybody.
6:20, and
care.
thank you all, and we will all talk soon. Take care,
Thank you.
everybody.
Happy New
Bye-bye.
Year.
See you.
Bye-bye.
Bye.
Bye. Thank you.